Hello and welcome to this video. When I started this channel, I started it with a video about inflammation and how inflammation relates to mental health. That video has the most views on my channel and as such has a lot of questions. So I've decided to make a part 2 to dive a little bit deeper into inflammation, how it relates to mental health, the mechanisms behind it and how to reduce it. So let's get started with the basics of inflammation. When we're talking about inflammation in relation to mental health, we're not just talking about the typical inflammation that happens when you're sick, we're talking about neuroinflammation too. So let's break them down. What are the differences? Picture the last time that you came down with a really bad flu. I don't mean the little sniffles, I mean like the really bad flu. I think there's something going around right now. A lot of us will probably relate to that feeling, or at least have that feeling very fresh in our memories. Think about the physical symptoms that you felt during that time. Think about how you felt extremely tired, how perhaps your appetite was gone, your body was aching, your muscles were aching, and you didn't feel like socializing, you didn't feel like going out, you preferred to isolate, and overall was not feeling in your best mood. These set of behaviors we call sickness behavior. And what's interesting about sickness behavior in relation to mental health is that the symptoms are very similar. If we compare symptoms of depression to symptoms of sickness behavior, there's a lot of similarities. You don't feel like socializing, for instance. Even texting or calling someone back can feel like such a draining thought. Well, neuroscientists ask themselves exactly that question. What if these sickness behavioral symptoms are the key to understanding mental health symptoms, since they have similarities? What if mental health is the mind's way of protecting us from our environment, the same way that it does when it protects us from a pathogen or a virus? So hold on to that thought as we carry on. It doesn't sound so out of reach. What this question does is it's asking medicine and psychology to think together. For the longest time, we've treated the body separately from the mind. Doctors don't have to study psychology. Psychology was not even considered a real science for a very long time. But what if both are very much connected and work in tandem? So today I want to talk to you about how the latest research in neuroscience is bridging that gap, how colleges like King's College in London are dedicating studies into understanding the neuropsychology of mental health, the biological mechanisms behind mental health issues, ranging from anxiety all the way to personality disorders like psychosis and schizophrenia. Excitingly, or at least for me, this field has its own kind of name, and it's called Immuno-psychiatry. If you're interested in reading about this, I will link a book below, which is a great introduction and has a lot of information about immuno-psychiatry, how it came about, what it is, how it works. I didn't write this book, it has nothing to do with me, but I think it's an interesting book to read if you're new to the topic. What immuno-psychiatry asks is inflammation a side effect of depression, or is inflammation directly the cause of depression? And the reason why we even ask that question is because most, if not all, depressed individuals show increased levels of inflammation. Now, the tricky bit about this is two things. Number one, the levels of inflammation for each individual are different. Some will be considered high and others will not. On the other hand, what neuropsychology and immunopsychiatry considers high inflammation is relatively low compared to what a doctor would consider as elevated inflammation. What we have noticed is that what immunopsychiatry considers high, in this case, is a protein called C-reactive protein. And C-reactive protein is released by the liver when the immune system is activated. Also often present during chronic inflammation that doesn't go away or that keeps coming back. 5 milligrams per liter of blood of CRP is considered high in immunopsychiatry. Doctors might disagree with that and say that that's very low. But that is enough to be present in depression, for example, and even treatment-resistant depression, which we'll talk a little bit about in a minute. So today I want to look at how C-reactive protein, as well as other inflammatory molecules, specifically cytokines, are related to mood, to mental health, how they hijack the brain and cause all kinds of havoc for individuals who experienced early life stress, childhood trauma, or any kind of difficulty during development. I want to specify that when I talk about childhood trauma, I don't necessarily mean something, how to say, we have big T traumas and small T traumas. Big T traumas are the more obvious traumas that we know of, such as experiencing war, disasters, loss, extreme physical and sexual abuse. But there are also small T traumas that we must consider. Small T trauma is trauma that wasn't necessarily life-threatening, but it was trauma that was continuous and chronic. For example, emotional neglect, criticism, or unpredictable caregiving where a parent was perhaps absent. It can be bullying at school, chronic illness, it can be poverty, moving too many times. Trauma is subjective. I don't want to give any definition because I don't want anyone to feel unvalidated by their experiences. Key distinction is not the severity of what happened, it's the responses from the nervous system. A big T trauma will happen through a form of shock as something traumatic, whereas a small T trauma will have happened through repetition. So this is what I mean when I talk about early life stress, childhood trauma, childhood difficulties. So now that we know what we're talking about in relation to trauma, let's talk about inflammation. Let's talk about the important subject of the day. Let's talk about inflammation. Someone asked me to define inflammation. Perhaps when you think of inflammation, you think of the 4 classic signs of an inflamed anything on your body, like a swelling, redness, heat, something painful that you feel on your body. That is how we understand acute inflammation. I'm thinking of another book that I will link below called The Inflamed Mind. If you're interested again in this topic, that's a book I recommend. But we are talking about chronic inflammation. Chronic inflammation is the team that shows up during an emergency, but instead of leaving once everything's done, they decide to stay and keep showing up for no reason. And the problem with chronic inflammation that won't go away is that over time it can start to cause damage. It can start to be maladaptive to its environment. So if we think back to our flu symptoms and the sickness behavior, when you have chronic inflammation, when these cytokines that we talked about are constantly sending signals that they need to defend the body, that we need to keep sending attack defenses, your body is then in a constant state of immune alertness. And as we discussed, that means that your body is going to show sickness behavior, signs that the body needs to defend itself. On extreme cases, of course, it's, fever and muscle pain and joint pain. On a lower side, during chronic inflammation, it can just be constant chronic fatigue, brain fog, digestive issues, low mood, meaning you don't have the energy to be yourself, to go out and socialize and do all the things that you would like to do. Instead, your body needs to recoup constantly and preserve its energy. Evolutionarily, of course, this is a biological necessity for us to have the ability to defend ourselves from viruses. But sickness behavior in relation to mental health, as immuno-psychiatry asks, is this a biological evolutionary reaction to stress, to the environment? Are our bodies reacting to stress via an immune reaction, such as chronic inflammation? If you hold up the list of sickness behavior that we've talked about against the list of depressive symptoms in the DSM-5, in the diagnostic manual, there's a lot of similarities, almost exact. And what the research is currently showing is that patients with depression, with acute mental health disorders, show inflammatory levels that are similar to that of someone who should be sick, someone who should have a really bad flu, someone whose immune system is working very hard to defend itself. Even without the presence of a virus, their body looks like it's fighting something. So what this tells us is that depression, for example, is not just in the mind, it's also very much in the body. It's very much present in the brain. The easy thing with a virus, when your body creates inflammation, it eventually starts to create anti-inflammatory molecules when there is no longer a need to fight inflammation. But when there is no virus and the body is in a constant state of stress, the immune system continues to send signals that we need more pro-inflammatory molecules, meaning we need more defense mechanisms. I think the most obvious thing that comes to mind when you hear this is, then why can't we just give people anti-inflammatory drugs? That should solve everything, right? Let's give everyone ibuprofen and yay, go, no more depression. But it's not that simple. And if we looked at studies, for example, who specifically looked at patients with treatment-resistant depression and looked at their inflammation levels, and they found that they indeed had high levels of CRP and high levels of pro-inflammatory molecule, which are called cytokines. They found that when these patients were given an anti-inflammatory that specifically addressed a cytokine called TNFA, the patients who had the highest level of inflammation showed some elevation of their depressive symptoms. However, the patients who did not have an extremely elevated inflammatory baseline, their symptoms increased. What that tells us is that we can't go around messing with people's inflammatory levels because, first of all, inflammation is very, very much necessary in the body. The body needs it to survive, to fight illness, to fight injury. Without inflammation, we cannot survive. So we cannot go around and eliminate people's inflammatory levels because that can become very quickly very dangerous. So what the study told us is that in cases of patients with depression and elevated inflammation, those patients can benefit from specific anti-inflammatories alongside their current medication, and those patients begin to show improvements in their symptoms, whereas before they didn't. However, those whose inflammation was not as elevated, their symptoms tended to either not improve or even worsen. The study also brings up an interesting question, which is why didn't all participants with treatment-resistant depression have similar inflammation? The answer, the theory, there are multiple potentially subtypes of and pathways that lead to depression. This specific inflammatory pathway is a specific subtype of depression. The theory is that there are possibly multiple pathways that lead to the same outcome. I will touch on those on a different video. Very briefly, the pathways that have been found to lead and cause depression includes cortisol dysfunction. The third and most common pathway is the neurotransmitter. Those are most commonly treated with SSRIs. The fourth pathway is related to neuroplasticity. The other is related to hormones. I will make a video to go more in detail on all these other pathways. These are all the biological and neuro-related pathways. Of course, we can't ignore the psychological impacts as well. Another interesting thing about low mood and specifically depression in relation to cortisol, anxious people tend to have elevated cortisol. Anxious people tend to have dysregulated and elevated levels of cortisol. However, patients with depression tend to show a kind of flat line when it comes to cortisol. If you're someone whose cortisol peaks in the morning, like myself, you would notice that when the morning comes, you wake up, your cortisol peaks, you get a burst of energy and you get your day started, you do your workouts, have your coffee, whatever it is that you do in the morning, where you get that little boost of it's time to get going. Patients with depressions, cortisol never tends to peak that way. It kind of stays flat, whereas a normal person's cortisol will peak in the morning and then slowly start to decrease until it's bedtime and time to go to sleep. Someone with depression does not have this. So you might be asking, but how does inflammation make me feel sad? How does inflammation in my blood make me feel a type of way? Isn't there something like protecting my brain from inflammation in the first place? The answer is we don't quite know yet. We don't quite know yet how inflammation goes from your body to your brain. There are theories that suggest these tiny cytokines pass through the blood into the brain, maybe via the vagus nerve, via the blood-brain barrier. Did I say that right? the blood-brain barrier. There is no official, yeah, this is how it happens. My personal opinion is that there might be multiple ways that this happens, just like there are different pathways that depression can happen biologically. The same thing might be in relation to how inflammation crosses over to the brain. But what we do know for sure is that it does, and it is present in the brain. Neuroinflammation can cause a lot of issues in relation to mental health via tryptophan and serotonin, as we discussed, via neuroplasticity, via literal physical changes in the brain. And these can lead later on in life to more serious illnesses like neurodegenerative illnesses. This is a super interesting topic of conversation, but obviously I'm talking about it. Like neurodegenerative illnesses such as Alzheimer's and dementia. And by the way, if you're interested in this topic and if you want to dive deeper in this topic and understand all the mechanistic pathways that cause inflammation to lead to mental health issues, how to treat it, etc., make sure to sign up for the newsletter to be up to date as to when the next workshop webinar will be available on this topic. Another reason why this is incredibly important in the field of psychology and in the field of medicine, it's because it literally shows us that you can't just think your way out of serious mental health illnesses like depression. They require as much a physical aspect as well as a psychological aspect. Right now we've focused on the biological aspect of depression, but of course there is an entirely other side to this, which is all mind related, self-belief related, worldview related. My dog is having a little scratch. Right now depression is treated pretty much the same way, no matter what your symptoms are. You get given an SSRI. And what this science is showing us is that, well, there are multiple pathways, so we can't treat everyone the same way. When you go to the doctor and you tell them you have depression and they give you an SSRI, did they test you for serotonin? How do they know that that's the problem? They don't. And I challenge you to ask them, why are you giving me an SSRI? How do you know that's the problem? Did they measure your inflammation level? Did they ask you about your lifestyle, your diet, your sleep? If you come back after taking these SSRIs and your symptoms didn't improve, you get put into the category of you have treatment-resistant depression. And we don't know how to treat that. What this shows us is that, okay, we don't know how to treat that yet. There are other pathways that we can look at, and we need to start looking at depression as not a one-size-fits-all kind of mental health issues. There are different subtypes, there are different triggers that lead to different pathways that somehow lead to the same outcome. Now, if we go back a little bit and look again at the perspective of this from an evolutionary perspective, we can kind of start to see why our bodies react the way they do because our environment. And the answer might just be that our bodies just weren't designed for the world we live in right now. We weren't designed to have our fight or flight responses triggered as many times as it does by things like emails and phone calls and meetings and whatever it is in your life right now that's causing you constant stress, bills, people, friendships, relationships. And that's only looking at things that affect us directly in our personal life. We're not even accounting for what we are witnessing, watching the rest of the world go through. Our fight or flight response was designed to literally help us survive, to make us flee from a predator, to fight against the cliche example I'm going to give, against the lion that's hiding in the bushes. It was designed to trigger that fight or flight response. In that example, in that world, if you were stressed, if your adrenaline kicked in, if your fight or flight response kicked in, it was almost guaranteed that it was because there was indeed a stressful event happening. And your body released all these hormones to prepare you for survival and to prepare you to fight against a potential wound. So the body evolved this incredible predictive mechanism where the second your brain perceives the threat, it preloads your immune system and it ramps up inflammation before even injury has happened. If a lion bites you and your immune system is already on high alert, you're less likely to die from your injury. It's a survival advantage, and it makes perfect sense for that scenario. But your biggest stress for today might be a deadline. It might be a presentation. Our stresses have become psychological, not so much literal. For example, public speaking. A recent study showed that public speaking increases your heart rate, increases your blood pressure, and your pro-inflammatory cytokines. It's almost like we're stuck in a survival mode that isn't actually helping us survive. It's become a maladaptive survival instinct that is causing increasingly more and more mental health issues. Let's move on to the good part of this video. The part where I tell you that this is fixable. We can't fight our daily stressors. We can't fight off modern society, but there are ways that we can lower our inflammation and support our bodies to deal with stress. These are the main ways that you can support your body and lower your inflammation. And let's start with number 1. Don't bite me for this. Reducing stress. Now, how do you reduce stress? I think what we can do here is reduce our reaction to stress. And we do that as a form of regulating our nervous system. We do that with mindfulness. We do that with practices like meditation and yoga, where we start to learn to be aware of our reactions and start to experience them as witness rather than as embodying them, rather than as a vessel that reacts to a chain of events. Once we take a step back, once we're able to be aware, once we're able to become self-aware of our actions and our triggers, we can take a step back where things aren't necessarily happening to us anymore, and we can gain a little bit more control over our emotions, over what triggers us. Another way to support your nervous system is to get, for example, a good night's sleep. I will not ever stop banging on about how important a good night's sleep is, simply because your brain literally washes itself out while you're in sleep. And it cannot do this if you're not sleeping a full cycle in deep sleep. And what happens if your brain doesn't get to wash itself out of toxins? Those toxins get to stay. Those toxins cause more inflammation. Those toxins cause less neuroplasticity and all kinds of other havoc that leads to brain fog and mental health issues, and further down the line, neurodegenerative issues. So please, if you do one thing, a good night's sleep. The second way we can really impact our inflammation level is through what we put in our bodies. You are what you eat. That is not a myth. Your brain feeds off of what you eat. So if you don't feed your brain the right nutrients, it can't work as well for you. So lowering sugar intake, lowering alcohol, lowering extremely processed foods, those are all ways you can support your body to reduce inflammation. And I will again make a video that goes a little bit more into details regarding what supports inflammation. I think that can be an entire video on its own, but there are enough studies with certain supplements that you can take. On the top of my head, I can tell you prebiotics and probiotics and omega-6s are a great way to support your inflammation. But as I said, I'll make a more in-detail video about this because there's a lot of information to provide here. Third is exercise. Yes, exercise. Exercise doesn't mean you have to go to the gym. It doesn't mean you have to lift heavy weights. Exercise is movement. Any movement that you enjoy. Exercise increases something called blood-brain derived neurotrophic factors. And this is incredibly important for your brain's health, for neuroplasticity, for your neurotransmitters' health and synapses to happen. Inflammation tends to reduce BDNF. The lower the BDNF, the less likely the brain can be adaptive, and the more likely for sickness behavior. Sickness behavior reduces BDNF and exercise increases it. And it's almost like a free way for you to improve your mental health. You just move and you gain more BDNF, which improves your brain plasticity, your circuitry, and your mood. Those are the main ways that you can support inflammation yourself at home. If you're able to go to a doctor and get your CRP checks, find out your inflammation levels, then bonus points for you. Do that. Thank you so much if you've made it to the end of this video. Before we sign off, I just want to leave everyone with a final thought. When you have sickness behavior because of an illness, what do? We call in sick, we cancel plans, we stay home, we rest, we give our body what it needs to recoup. We accept there is going to be some downtime and we don't judge our bodies for it. But with mental health, we tend to do the opposite. We tend to beat ourselves up. We tend to be very harsh and judgmental about what we can and can't do. But if we start to see mental health as a systemic issue, as the body literally screaming for help for us to rest and change our environment, would that change how we treat ourselves and how we perceive mental health? If we stop fighting against the sickness behavior in relation to mental health and actually listen to it and give the body what it needs, would that improve our mental health? Mind-body therapy sits exactly at this intersection. Instead of just asking why someone feels the way they do, it asks, what is the body also responding to? That is what mind-body therapy is really all about. It's listening first and figuring out what each person's individual nervous system is responding to and how it's chosen to respond, and how to support it to become more adaptive rather than maladaptive. The body and the brain will do whatever it takes to survive, and sometimes that means maladaptive responses. Thank you so much for watching. If you've made it this far, I hope this video was a little bit more informative and dived a little bit deeper into inflammation and mental health. I know we focused a lot on depression, but that's because the research currently is focused on depression. I'll see you in the next video where we'll talk a little bit about authenticity. What it is, what it means, what does it even mean to be authentic from a neuroscience perspective, from a biological and psychological perspective. What does it mean to be yourself? How do you know when you're being yourself, or who even that is? If you've experienced trauma, especially early childhood trauma, you may have had to let go of your identity of who you are in order to survive in your environment, in order to be the person that your caretakers wanted you to be. Anyway, thank you so much and see you next time.